Recently, Dr. LH Hiranandani Hospital organized an influencer panel discussion to create awareness about childhood obesity and diabetes, concerns that many parents are increasingly facing. The session brought together specialists from the hospital along with few incredible mom creators who share their experience and perspectives.
So, hi, I'm Kiara Pawar, India's youngest sportscaster as well as a diabetes advocate.
Myself, Kritika Kataria, a mom influencer and a mom of two kids.
Hello everyone, I am Dr. Sanjeev Ahuja. I am the Director of Pediatrics and a full-time consultant for pediatrics at Dr. LH Hiranandani Hospital, Powai.
Dr. Vimal Pahuja. I am an Associate Director of Internal Medicine and also a metabolic physician, diabetologist, obesity expert at Dr. L.H. Hiranandani Hospital.
I'm Dr. Payal Jain. I'm a dentist and a part-time mom content creator. I have a small child as well.
Hello, I'm Divya Jain. I am a mom of a 2-year-old. I'm a mom creator.
Umbrella under which there's type 1, type 2. Can you please tell us that? Can you tell us how it is? What is type 1 diabetes? What is type 2 diabetes? And there's also a rise in diabetes cases in our country. Why is that happening?
So, first of all, in a very simple nutshell, I'll explain you. Type 1 diabetes, as you know, that is complete deficiency of insulin. There's no insulin by various factors. It can happen. Unfortunately, pancreas stops secreting insulin and you get type 1 diabetes. Whereas type 2 diabetes, type 1 diabetes, but type 2 diabetes is where you have sufficient amount of insulin, but you're not able to use that insulin effectively. Your body cells have become insulin resistant, and that's why you get type 2 diabetes, where the blood sugars are not being used by the body. Now, rise in the cases is because of change in the lifestyle. That is the first thing which I will say. Less of sleeping time, more sedentary time, not moving much, eating processed food, eating a lot of calories, increasing obesity, spiraling increasing diabetes. Type 1 diabetes also is increased recently. Because I think that also is fueling the type 1 diabetes. So these are the reasons I think that cases have increased in the recent number, and 101 million people are diabetic in India currently, type 2 diabetes. And more number of people are not diagnosed. Same number of people are still not diagnosed. And out of that, 77 million people have pre-diabetes, which are waiting to become diabetes.
That is totally true. I think India is a diabetic capital of the world as well. Coming to you, Dr. Sanjeev, you see kids every day. What are some early signs you want the parents to keep an eye on to avoid the risk of weight issues or diabetes?
So as we just said, type 1 diabetes is also called insulin-dependent diabetes mellitus. It's fortunately not as common as type 2, which presents in adults. But in the last 2 decades, more and more cases of type 1 diabetes I've been seeing in practice. Nearly once in 3 months, I see a new child who presents with an acute crisis called diabetic ketoacidosis, wherein the child is very critically ill, has very fast breathing, is dehydrated, is in a state of shock, low blood pressure, the pulses are not palpable, where a lot of fluid has been lost from the body because with the high blood sugar, there is glucosuria. So as a pediatrician, in our routine practice, if I see a child who is not growing well, who's constantly not putting on weight and height, and the parents seem to say that he eats quite well, it's not that he has a very less intake, but in spite of that, he's not growing well. Or if there is a history of recurrent infections, recurrent respiratory tract infections, skin infections, pustules on the body, or if they have found that the urine seems to, attract a lot of ants if it has, the baby has passed urine in the diaper, say an older child also who's wearing a diaper. Or if we specifically get a history of the child feeling very hungry at short intervals, every 2-3 hours the child wants to eat, which we call polyphagia, or is drinking a lot of water and also passing a lot of urine, which we call polyuria and polydipsia. So these are symptoms which are very specifically seen in type 1 diabetes, where the body is not producing or is producing very less insulin, and therefore whatever the child is having, the sugar is not getting controlled. So to summarize, these are the symptoms, but in children, in fact, a lot of children who have diabetes, they are not obese. So it's not seen in obese children. However, obesity is a precedence or a risk factor for type 2 diabetes for sure, but also may have some role in type 1 diabetes.
Okay, thank you, Dr. Sanjeev. Coming back to you, Dr. Vimal, today's kids, they're considered carefree, but there's that side where they're very stressed nowadays. They're spending a lot of hours on the phone, and a lot of junk food is being consumed. And as you said, lifestyle factors is the most critical part. How, according to you, can probably parents and all keep an eye on these lifestyle factors and avoid this to happen?
To say that these to improve the lifestyle is very simple. It's very difficult, especially if the parents are following a similar kind of lifestyle. So what we do need to understand that the parents have to become an example for the children to actually allow them to follow that kind of lifestyle. So they have to set an example. They have to start reducing the screen time. They have to show them that they are eating healthy themselves. One meal or two meals a day, at least the family should sit and eat together so that they share a similar kind of meal pattern. Sharing a similar kind of meal pattern helps. Now we see people are eating isolated, child is eating alone, parents are eating alone. This happens and this is a fact, we know that. But that's actually a main reason, because your meal pattern and your food preferences keep changing on the basis of your whims and fancies. However, if you sit together and eat, probably you can discipline that eating. That's the first important thing which I feel the parents should be doing. Playtime of 60 minutes by our Indian consensus. 60 minutes child should play daily. At least 60 minutes playtime should be given to the child. That is number 2. And number 3 is, of course, the screen time and regulate the sleeping time of the child. That is the most important thing. I think that we are missing the link here. The Netflixes, the other things is creating problem. And then children are also getting used to that kind of lifestyle. So yes, it's very important to regulate the sleep also, along with the eating as well as the exercise, which is very important. And most importantly, making them a better children, that you have to show them that you have to give them the proper way. Now you see that one of the child, was trolled for being rude on the KBC. Now that kind of mindset is very important. What kind of mindset you are giving to the child? Acceptance, tolerance, perseverance, these qualities are getting smaller and smaller. We're not seeing that kind of childhood or what we saw. So those qualities you have to start teaching to the children. That's very, very important. All this will make a complete child. And what studies have shown that if parents are included in this changing, lifestyle changing, habit changing the studies, the child do much better than if you just intervene on the child. If you keep telling the child, don't eat this, don't eat that, that's not going to happen. So parents accompanying with the child do much better if the lifestyle changes are advocated.
That's definitely true. I think, as you said, acceptance, tolerance, that needs to be taught at an early age. Coming to you, Dr. Sanjeev, personally, whenever I used to take insulin in public, it used to be very challenging. We spoke about parental support. Now, if you had to say, how can schools support children, if they are obese or if they're facing something like diabetes?
Right. So, if a child has been diagnosed to have type 1 diabetes, it's very important that the school, the class teacher, and whoever is going to take care of the child, even a little bit indirectly at school, is made aware that this child requires to take insulin injections. This is not a disease which we can control with any oral medication. First, of course, the immediate family is what I counsel. It's a big shock to any parent when they know that their young child has a disease which has control but not a cure. So diabetes in children can be very well controlled. The child can live 100 years, but you can't come to a situation where you will not require insulin. At least medical science hasn't provided any such modality as of now. So the school should be aware that this child has to take an insulin injection a few minutes before every meal, and also that if the child has suddenly a low blood sugar, which suppose the child has taken the insulin dose but has not eaten well, what are the symptoms of that hypoglycemia, low sugar, which is very important to detect, because in an acute situation, a low blood sugar is more harmful than the high blood sugar. So if the child suddenly faints in the class, has a lot of sweating, has headache, has nausea, vomits, then at that point of time the sugar should be checked, and if it is low, then immediately some glucose powder or glucose biscuits should be given. And when the child who has diabetes is not well, suppose the child has a viral fever, during those days of being unwell, that stress period, it's very often seen that the sugar spikes, because during stress we have cortisol release, which makes the sugar levels high. तो वो टाइम पे monitoring the sugar. So the parents, the grandparents, the servant, or whoever is taking care of the child in the house and the school staff should be aware that this disease is very well known entity. There's nothing to be scared about it. It's not a taboo. It's not because of anyone's mistake. It's not because something could have been done to prevent. These are all misconceptions. It's a proper disease. It can be treated or rather at least controlled. And please allow the child to have a normal childhood, to indulge in all sports activities, other activities, academics, and even indulge in nearly normal food. There's a lot of restriction on the food as soon as you're diagnosed to have diabetes. Now, when children first are diagnosed, they are in a state of catabolism. They have lost a lot of weight. In fact, their tissues are kind of requiring more food because whatever sugar is there, it's not being utilized. So, giving your typical dal, chapati, vegetables, nuts, fruits is very much allowed if you are giving the correct dose of insulin and monitoring the sugar. So very severe restrictions and stringent rules should not be applied on these children. Please allow them to, live a normal life.
Yeah, well said. Because most of the time we are looked as if we are not normal. Apparently, for some, people, diabetes is contagious. Coming to our wonderful and amazing mom influencers, they are raising kids in this digital sugar-filled world. I'm super excited to ask you all questions as well. My first question is to Dr. Divya. Today's kids, they, as I said initially, they are on their mobile phones for a long period of time, as well as consuming junk food side by side. As parents, how can you encourage your kids, that, and probably not make them feel restricted, that you're handling it in a proper way?
So my first, I start with one meal a day together. I ask my husband, you have to take time. One meal is compulsory to sit with my daughter and have. And her food is not different, a little less spicy. But what we eat, we tell her, you can eat this. This is adult food. This is child food. But you can taste if you want. So by this pattern, she knows everything what we are eating. And she goes to a play school now. So there, my biggest struggle is there. So I can't tell other parents, please don't put junk food in your kids' tiffin. So one day the teacher told, your daughter wants to eat other child's tiffin, and the mothers, they have sent some stars. Or I didn't knew what that was. So I googled it. So there's a brand called Slurp Farm. So they make healthy food items, but I have never tried them because I make home food in different forms, and she loves eating that. And second thing was, while cooking, she's just 2 years old, but while cooking also I make her sit next to me for her food what we cook. So she loves pastas. So I started making Slurp Farm pastas. They are this maida free and all. So while cutting vegetables also, she is involved. So she knows now everything. Okay, this vegetable we can use, this we can use, this we can use. So she eats also. Can I taste? You can. So this is my thing to make her involved in healthy food items. And there is no television for her. So right now she doesn't see any ads. So abhi tak I am safe, you can say, because we have a rule like she can't see any screen time right now. But there is a challenge for me because my daughter is very like, if I want to do this, I will do this. If I want to eat this, I will eat this. So school thing is a challenge for me because she has done 2-3 times. She has eaten the whole tiffin of her colleague, her classmate. So this is a time, but I think giving time to them and discussing, because 2-year-old can understand everything which I feel, and if you discuss with them, I think they will definitely understand.
Good.
Okay, moving on to you, Dr. Payal. So my question to you is, we see junk food a lot in tiffin boxes. And as she said that, she took the initiative to understand what can work best for her child. How, according to you, can tiffin boxes can be probably more appealing towards the child, but you also know that those protein intake, everything is right there.
See, what I normally do is I try to give my child, balanced treats when it comes to sugar craving. I try to give him small portion of the sweet, maybe after his meal, a small part of the dessert, so that his sugar craving is controlled. And then, like Divya said, I try to involve him in the kitchen work. Not very big work, small works like mixing few ingredients, washing the vegetables or fruits maybe, so that he comes to know whether this is healthy for him, this is junk, so that he has choices to decide. Then I don't give him packed foods. I normally don't say no. I try to give him, but if better, I try to give him healthy snacks which I prepare, so that a bit healthier type. It has sugar in it also, but then a less amount of sugar I use. And then we normally have a family detox time, which I say. Like there is no screen time. My kid normally watches TV and screen for maybe 10 minutes, 5 minutes I give him. I mean, he's 4 years old now, and it is definitely not, I cannot say, no, you don't have to watch only, because he won't listen to that. So I give him, but then when we all are together, it's like 1 hour or maybe 45 minutes. We are together, we don't watch TV, no phones. We can go for a small walk, or maybe if that is not possible, we can play a small board game with him. He doesn't feel left out, like, that's it.
Okay, coming to you now, Kritika. We spoke about what we should do to avoid certain things for our kids, but there are so many kids probably facing obesity or diabetes. In my case, I was bullied because I was diabetes, because I used to go to the nurse and take injection. How, according to you, is important to teach the child to be empathetic, understanding towards someone who is facing diabetes or obesity?
First of all, I will tell my kid that see, we are living in a family. Somebody is tall, somebody is short, and somebody is fast, somebody take more time. So everybody is different, and this difference is completely okay. First of all, and second thing I will tell that see, as there is a garden, different flowers are there, and that makes the garden more beautiful. So the difference is completely okay. Second thing I will tell that we should accept the person as it is, because there is a uniqueness. Every person is different and they are unique. And we should not use rude words or something that can hurt them. Third point I can say is that I will tell that we should have, we should treat with them as simple as they are same as us. We should not separate them that you are like that. So this is the main point, and we should not feel bad for this.
Thank you so much. Coming to you, Dr. Vimal and Dr. Sanjeev. There was a time back then, a lot of years ago, like initially parents used to tell their kids कि घर आ जाओ अभी बहुत तुम बाहर रह गए अभी घर आओ अभी. And now it's the opposite. Now parents are actually telling the kids that you go out, don't be stuck on your phone, go do some physical activities. How important, firstly, what do you feel on this change, and how important it is now that for parents and kids both to learn then?
Yeah, so we feel that we have developed a lot and technology really helps us, but these are the hazards of becoming so-called more advanced, is that we are actually going backwards in terms of our health. Basically, whatever we are talking today is basically what we are discussing is सही और गलत में फर्क क्या है, किस लिमिट तक जंक फूड ठीक है, किस लिमिट तक शुगर सॉल्ट दे सकते हैं, कितना एक्सरसाइज करना चाहिए, कितनी फिजिकल एक्टिविटी होनी चाहिए. अब there are no fixed margins for this. Most of these things one has to, even the food has to be as per the family food. कोई अगर non-veg है, so as a doctor I can't tell them become vegetarian or vice versa. But definitely physical activity, playing outdoors, there is no replacement of that. As he just said, almost more than 1 hour of physical activity is extremely important, because as we grow older, we have more studies, the child has more studies, has to spend time reading, studying, obviously cannot dedicate that much time going and playing out. So at least when they are lower standards, they should indulge in some activity. They should, whatever, everyone may have an aptitude for some sport. It may be badminton, it may be just table tennis, but not like watching a game on a screen. So this outdoor activity is extremely important to spend calories. So even if the child is eating sometimes a little portion of junk food, but he's going and playing, he's spending calories, and it's a routine which is set that he has to do it rather than being inside the house. That is extremely important. And children who don't have enough activity, obviously develop childhood obesity, and with that obesity comes higher risk of high blood pressure, high blood sugars, high lipid profile. So all of them then cause metabolic disease or increase the risk of heart disease in an early age. Over the last 5 years, especially in the post-COVID era, because people were isolated at home, they were in lockdown. So at that time, there was very less activity. And that has unfortunately stuck on with many youngsters and teenagers, that even now they tend to stay indoors. And the number of cases of childhood obesity which I'm seeing between 2022 to now is alarmingly high. So even if a child comes to my room for some other routine problem, a cough, cold, or a vaccination, I'm not exaggerating, 1 in 4 to 5 children is overweight. And we have objective criteria to call someone overweight or obese. We have something called percentiles in children. So somebody who's the lowest is the first percentile, जो सबसे ज़्यादा है 99th पे. So we are having a lot of children who are more than the 95th percentile by weight, and when we check their blood sugar, blood pressure, a lot of them at the age of 11 to 14 already are pre-diabetic. So they are not walking but running towards a bad situation. So that's why physical activity constantly happening from young childhood, encouragement of indulging in sports, whatever the child may like. The parent should never force for a particular thing, but some physical activity on a very regular basis, avoiding a sedentary lifestyle right from childhood, so it continues when you're an adult. So if I never exercised in my childhood, it's very difficult for me to suddenly do that as an adult. वो एक वैसे ही हो जाता है, स्वभाव हो जाता है. So that's from childhood is very, very important that we have regular physical activity. And parents are role models. If the parents are sitting with the child at the meal time, eating the same food, every child over the age of 1 year should have the same food as the parents. There should not be separate cooking. And between 1 to 2 years, the milk intake, use of a bottle for milk, all this should be drastically reduced, because if the child doesn't get milk frequently, he or she is bound to eat other food. What happens in most families, because child is not eating, it's a fussy eater, they keep offering milk. Child is addicted to milk, it gives a lot of empty calories, and the child doesn't have a habit of eating fruits, vegetables, tends to be iron deficient. Iron deficiency again causes problems in brain development, increases chances of hyperactive behavior, temper tantrums. So one thing leads to the other. So proper diet, nutrition, same as the parents. Typical Indian food has everything. We are blessed to be in this country where our routine food, if you eat our typical dal, chawal, chapati, sabzi, it provides everything. So all big talk about so much protein, carbohydrate is okay theoretical. Nobody can calculate 1 gram per kg per day, how much their child took. That is all okay for publishing somewhere. But your own home food in moderation, some amount of sweet and dessert sometimes, along with good physical activity, minimum screen time. Below 2 years, I would recommend 0 screen time, and 2 to 5 years up to 1 hour is allowed. The main reason for that is screen time below the age of 2 years has a strong link with autism spectrum disorder. Apart from screen time, obviously you're sitting and you're not doing physical activity, so you tend to put on weight. But it has a strong link with something else also, which is delayed speech development.
I thought you were to be very succinct in answering. Okay. So, see, point is that we are having an industrial revolution. If you see the industrial revolution and if you see the obesity onset, they match. So, industrial revolution has led to the obesity revolution as well. The cola industry came, then you understand the food industry has evolved, and along with that, your disease has evolved. That is number one. Number two is that as you will evolve, you're more technology dependent. The physical activity is going to go down because you are more going to be, involved with your gadgets and your others sedentary jobs and all those things. And it is a part of the evolution. You can't help it. You have to go in that way, or you have to reverse the entire evolution. See, I'm painting a bigger picture. These are smaller incidents, but I'm taking a bigger picture that this is going to happen. How we can improve in that? Evolution cannot stop, technology cannot stop, screen time is going to be there. How we can actually bring solution in this, we have to understand. And as I said, parents have to be role model. As he said, we have to say that we are also physically active. Go take the child for a walk so that they develop those habits. Okay, cut down the screen time. restrict their screen time so they understand why it is important to restrict the screen time. Talk to them about the research of lack of sleep. That there's a research clearly done in US where they've said that the screen of your mobile is blue, but they've changed the screen from blue to yellow because blue screen releases melatonin. Melatonin, Satyacharan Panda has done research in Salk University, and that's why entire people who are doing work shifts or doing firefighters, they've tried to change their blues. They have been given yellow screens so their melatonin levels are not affected. So all these things have to be understood, that how we can improvise in the given environment. You cannot impose rules on children. That's not going to happen. 4 hours screen, 2 hours screen time, I will not give you more than 2 hours. And there are going to be fights. The child is stubborn, what you will do? So what you will do? See, this is good for speaking that I have 2 hours screen time, 3 hours screen time. But in reality, it is not practically possible because he's seeing the other child is doing this. There's a lot of peer pressure. In the junk food segment also, when you talked about junk food segment, there's a lot of peer pressure because so many people are doing, right? I have to make a reel because so many people are making a reel. So how can you avoid that? The peer pressure is going to be there. We have to answer those questions practically. What are the harms? What are the other sides of those? And we have to sit and discuss with the child. We have to show them, and they are inquisitive. If you answer their questions logically, their curiosity is killed, they will understand. And they will make others understand. They are much better than as adults in understanding and making others understand. So we have to frame our mindset, our perspective has to change. Okay, rather than 1, 2, 3, 4, 5, this should be done. I am not in that favor. I'm not that kind of a doctor. I try to find the solution in that unconducive environment. You're to bring the solution. Problem solving is not. You solve the problem there. Then only your child will be happy. Then only he will do things. He will be able to imbibe the technology properly and also take care of his dad. So I think this is a very practical environment solution. Otherwise, giving mantras and commandments, 10 commandments, not going to work.
With regards to peer pressure, actually, most of the parents, they don't understand peer pressure, that my child is going through peer pressure. Every second or third child is going through that. There was a phase in my life I was going through peer pressure. How, according to you, from a doctor's perspective, you'd want to say that parents should understand that peer pressure is there?
So, as I said, if the child is behaving in such a way that he's not accepting your guidance or not accepting your advice on certain things, you have to talk to the child. ये क्या लाया था टिफिन में? And he will give you the cues. Why you should ask? He will give you the cues. You said they are much better than I am a father, they are mothers, they know better. That the child will give you the cue that he got this from the house, he got that from the house, and this is what they are eating. So they will give 1, 2, 3, 4, 5. People are bringing this stuff, they are wearing this stuff, they are watching this, they were reading this book. This cues children will give it to you. You don't have to ask them, and then you understand there is he's going through a peer pressure because he's an influence, and that's why he's doing this. You understand that, and then how to break that peer pressure. You cannot do it, go to a counselor, that's fine. Counseling should be done. I think why we are shying away from the mental health. It's very important that child counseling should be done when they are going through the peer pressure. If you're a parents will feel that we'll be able to handle that. It's not possible. You will not be able to handle it. Sorry. It's child counseling is important. Go to a counselor because a neutral person, she will try to gauge what's happening to the child, and she'll be able to nullify that, because you will have some prejudiced mindset, or you have some bias because he's your own child. So I think it's important that child counseling should be understood. That child counseling is important, and that point of time, if you feel that peer pressure is there, go to a counselor. We don't try to do that. And child counseling and counseling will be a very important part, as your physical health, mental health is important. So at every step, it was not common during our days, but now it is common, it should be done. At every step, 5 years, maybe 10 years, 15 years, it should be done. My own child, I tell her, go to the counselor, sit, have a session. I when I have a problem with MBBS examination, we sat with the counselor, our own, and we said we want a session because we are going through a mental challenges. It is not that curling it. Why it should be mentally always? You should say that I am vulnerable. Show your vulnerability to your children also. then they will understand that everybody is vulnerable. Showing a vulnerability is very, very important. Not always rigid. No, show a vulnerability and they will be understand this. Vulnerability is there. I am also vulnerable. Going to counselor, okay. Talking to somebody, a friend, a counselor, it helps. So this will be able to nullify the peer pressure. They will develop their own. Peer pressures are influencing. They are getting influenced. You are influencers. They are getting influenced by other people. So if they are getting influenced, how they can develop own thought process? When they break from that peer pressure, then they will be able to develop what is right or wrong for counseling their life. Don't panic. They will understand this is well, this is what. After have a clear thinking and dialogue. Okay.
Dr. Sanjeev, do you want to add something on this?
Yeah, so I think the parent has to spend time with the child. That's most important, and has to understand what is bothering the child. If the child is remaining unhappy or is not doing well in studies, or because of peer pressure is remaining upset कि वो ऐसे कर रहा है, उसने वो चीज खरीदी, I have not been able to buy it, or that child is watching something on whatever some platform, or is doing such and such studies, going for some tuitions. So there's always going to be a comparison. Children compare themselves with others. There's also a lot of body shaming. Somebody who's say short or fat or thin, too thin, whatever. So children or adolescents tend to make fun. So the parent has to reassure the child, as she correctly said, that everybody is a different human being. Everyone is unique, has his own good qualities. Everyone can't be perfect. Everyone can't look like Hrithik Roshan. But whatever you are, in that you must do your very best. So you have to encourage the child to spend a proper time. There should be some discipline, but it should not be forced. So it should be in a loving way. It should start from early childhood. The child should be slowly taught what we always said, sanskar ya moral. So what is sahi, what is galat, what is the correct kind of food. They should be made to understand that all these ads and all these platforms, like say, name them like Zomato, Swiggy, who are supplying food at a very cheap rate, who are giving you food within 10 minutes. You can think what must be the quality of that food. Is it really stale food, freshly prepared food? What kind of oil or material they must be using to make it dirt cheap? So if they understand that this is obviously a commercial vested interest of someone and it cannot be as healthy or good as my own home food, the parents are constantly themselves not indulging in bad habits. So it's ultimately a good adult can make a good child in the house. If the parents only are smokers, drinkers, and every day eating pizzas and burgers, and then they tell their child कि तुम सिर्फ पालक खाओ, so that's not going to happen. So every human being has to do his job properly. As a parent has to be responsible for their child's upbringing. What we used to say कि proper upbringing makes a difference in later life. That is extremely true, both for physical and mental health. And peer pressure, definitely counseling, the role of a child psychologist is going to increase with increasing environmental influences. So child today has so many things that he sees or hears which influence the very sensitive and innocent mind. And the child has to be made to understand what is correct, what is wrong, what someone is. So even if they see something which is very violent in a movie, they have to be made lovingly to understand that this is a story, it's not something true. Somebody is doing it to make money, that is their profession. Don't take it seriously or think that this is the reality.
Yeah.
So the parents have to spend time with their child, constantly have meals together, indulge them in cooking or even buying groceries together. For older children, you can take them. Make the healthy food like chapati, dosa, idli more colorful. Put it in a pattern or in a shape which is more attractive to the child, rather than getting a pizza or burger or giving cream biscuits. So your own basic food can be made more interesting. And do allow them some amount of sweet and some amount of so-called junk once in a while, on occasions, on birthdays, or if you are going once in a while to a birthday party. Everything in moderation. Encourage them to have more of salad and vegetables. If the child is a little on the overweight side, tell the parents, don't force feed. A lot of parents force feed their child. Their mother takes it as their, कि मेरे को तो 2-2 घंटे में खिलाना ही है. So don't do that. The child will eat how much ever he wants. And you can, in fact, restrict and let him have about 75-80% of the food. Don't, while watching TV, keep having snacks. That's a very common reason to develop childhood obesity. This extra, feeding. Eat at breakfast, lunch, dinner. अंग्रेज लोग ये 3 टाइम बना के दें, कुछ अच्छा करके दें. बीच-बीच में snack मत करो. Or if you have to, then just indulge them in some play activity, some board game or something like that, so that they don't keep eating. And as we've already discussed, switching off a device for at least 30 minutes before sleep, children not being given a device, and it's inevitable. Screen time is going to increase. What we are talking is also going to be seen on some screen. So that is inevitable. But everything in moderation.
Absolutely right. Actually, as you said, parents spending more time, whether it's cooking, buying grocery, washing vegetables, whatever it is, it's quite critical for the young kids. The last question that I want to ask actually all of you all is, our main goal was to spread awareness on creating understanding about childhood diabetes and obesity. What is that one key message you all would want to give to the audience?
So I think very importantly at all points, everybody has brought out their points in the next, and you touched upon very relevant points about obesity, that how obesity is increasing. And that's, as I said, quality time spending of parents with child. That is the first thing. And then changing the habits slowly. The behavioral change is very important. So my key message to everybody should try to change the behavior, not with force, but with a proper love, understanding, and working it in a planned manner. That will only change everything. Screen time, food habits, physical activity, everything will change with that. So, and that behavior will be constant. From child, that behavior will be passed on to adulthood. So it will lessen the adulthood with obesity also and diabetes as well. So behavioral change, inculcating good behaviors in the right manner, in a planned manner, is the key to actually prevent all these obesity and diabetes hazard.
Yeah, so I think to summarize, yes, both diabetes, especially type 1 diabetes, those children who have, they should be constantly encouraged in society to lead a normal life. It's not their fault, it's not their parents' fault that they have it. It's unfortunate, there are a lot of things like that. This is also not in anyone's control. Obesity also is often hereditary, but there is a strong environmental influence that can be controlled to some or largely with the diet that, as we have just spoken in length, how the parents see to it in a loving, affectionate manner, teaching their children what is a good food, basic home food, with dal, paneer, curd, everything that provides, and if the family is non-vegetarian, egg, white, chicken, good amount of protein, not totally shying away from carbohydrate, everything is important, but to keep a proper balance, and never to consider anything, diabetes or obesity, as a taboo, to criticize people who suffer from it, or say, it's like you can call it a disease or a ailment. You can't, make fun of it or criticize the person. You have to help the person to, succeed in treating it properly. And it's often a joint effort of a lot of physicians, therapists, etc. So somebody has dengue, you don't scold the person, no, dengue ho gaya. It's a disease, you treat it. So similarly, childhood diabetes has to be dealt in a very proper, sympathetic manner. And a sedentary lifestyle and junk food are going to kill us in the next few decades. So we have to make our children, the future generation, understand the difference between right, wrong, and inculcate all the good habits. I think to summarize, we have to bring up our children as if we are in the 1980s. If we behave as if we are in the 1980s, we'll have a better future generation.
Also, I feel the initiative taken by Food Farmer to introduce the charts, sugar charts in the school, if you have heard about it. So I think such initiatives are also very important, that your child labels all the packet food items in which category, green, yellow and red. So such initiatives are very necessary, and the key thing I would say is time. Giving your child time and who your child is spending time with. I feel the behavior, the food pattern, everything comes from there. I grew up with my grandparents and parents. So I think what today I am is because I got that family time. So if we also want our children to be like us, disciplined, maintained, everything, so we have to give them time. Work focus is today's, priority, but we have to change some things for them, give them. I think the best is time management. They'll learn everything from us only. Because my daughter is 2 years old, what she speaks, I feel whatever she's seeing around in her house, the helps, the maids. So whatever she learns, I think this is from her environment only, the surrounding. So who your child is growing up with is also very important. So everything comes from there. Right.
As for the discussion done, so what I feel is everything can be done in moderation, which will not affect, likewise the doctor said, everything can be done but in moderation, so that the child also enjoys what he's doing and limits are given. And also I feel like we being the role model for the child, for our child, so that he enacts what we are doing, what is good, what is bad. That's true.
Yes, as the discussion, my daughter is 14 years old, she's a teenager, she's having all these mood changes and all. Sometimes I feel that he's having changed disease or something, but no, we have to think, start from home. If she is doing, we should explain that what actually it is. It is not a disease. We want to eat something, you want to eat, but in a limit. And we can make the creative at home. Suppose the kids is to eat pasta or pizza. So we can make and we can start from the home only. So the thing is, I learned that it is not a big issue nowadays. I know from as I am in a survey, I have learned that after some time, every child will be having a diabetes. And now the one concept have came in many friend parents. Up to 1 year, they are not introducing salt and sugar to the kids. It's a new initiative that they are not just giving salt and sugar. But may I know the reason for this?
We do recommend to start weaning food, that is apart from weaning food between the age of 6 to 12 months. But yes, we don't recommend sugar or salt. I would say a small amount of a pinch of salt I do recommend to patients to put at about 10 months onwards of age, but sugar not till 1 year of age, because milk per se has some sugar in it, mother's milk as well as formula milk. Cow milk also we don't start till 1 year of age. The salt can have a little burden on the kidneys in a child below the age of 1 year. And again, sugar is not recommended because it would raise the blood sugar level and then lead to certain insulin spikes and changes in the metabolism. So we don't recommend. Fruits naturally have sugar as well as rice and some other cereals would provide. So yeah, we don't recommend sugar, salt till 1 year of age.
I experience sugar rush also.
Those children, what he's saying is that say metabolically the children below the one year, you will not need, because they don't need sugar like you need, because they're not under stress. So why you need to give sugar spikes to them? Salt also, I think whatever pinch of salt he says right, but all the stuff which we give to the child, breast milk is of course has blood sugar inside. The natural milk sugar is always there. So we necessarily do not give, because people perceive their taste buds and their habits, the child will also feel the same. That's the reason why they start doing these things, but actually it is not. So that's why change of perspective is required in that sense, because what you feel is not for the child, it's not for the child. So you have to understand their parents have to be made aware, the grandparents specifically. I think they are to be made more aware. Because when the parents will say, बहू बोलेगी लेकिन सास और ससुर नहीं सुनने वाले. So that's another problem, another challenge in our country, where the grandparents still rule the destiny of the grandchild. Their eating patterns, their behavior, all sometimes they're defined by grandparents also. And because of their older habits that you should eat more, in fact the pregnancy also they're doing pregnancies and lactation fetus, because giving more calories and creating obesity. So all these they also have to be actually scoped.
As you rightly said, it actually starts from home. घर से ही तो शुरुआत होती है. And honestly, it was a wonderful conversation that I had with all of you all. And I hope the audience understood, what actually happens in childhood diabetes, childhood obesity. And this conversation personally meant a lot to me, being a type 1 diabetic myself. I want to say thank you to the doctors as well as the mom influencers.
Thank you so much.